In the middle of heart surgery, when armed attackers entered City General Hospital, Dr. Maya Thompson's hands were over the patient's open chest. While security alarms blared and other operating room staff panicked, Maya did something different. The way she secured the operating room. These weren't procedures a normal surgeon would know, as if she had operated before under enemy threat in much more dangerous conditions. "Dr. Thompson, how can you stay so calm?" asked operating room nurse Jennifer as panic sounds came from the corridors. "Focus," Maya replied, but that focus didn't come from ordinary medical training at all. But what Maya did in the next 45 minutes would reveal a secret she had kept hidden for 8 years, because her way of moving was like someone who had operated in war zones. Welcome to Hidden Legends. Before we continue with this powerful story, tell us in the comments which city you're watching from. And if you believe stories like this deserve to be told, hit that subscribe button. Dr. Maya Thompson had been working as a cardiovascular surgeon at City General Hospital for 8 years. At 36, she was one of the most skilled heart surgeons in the hospital. Together with operating room nurse Jennifer Davis, anesthesia technician Marcus Lee, and other staff, they performed 3 to 4 critical heart operations daily. "Maya is our most precise surgeon," said cardiac surgery department head Dr. Robert Chen. "Flawless technique in complex operations, perfect control even under high stress. Patients trust her completely." But Maya's extraordinary composure and precise surgical skills came from a much different and deeper experience than normal surgical training. Jennifer found Maya's behavior during critical surgeries different. "Maya, how do you stay so organized during the most stressful operations?" she would ask. "Discipline," Maya would say quietly. "Protocol and focus are required in every situation." This discipline came from a 10-year career as a Delta Force combat surgeon. Maya had conducted medical operations in the world's most dangerous places. Dr. Maya Thompson's real story began 18 years ago. She had joined the military at 18. But why? It wasn't family medical tradition. It wasn't an academic scholarship. It was completely different motivation. In her childhood in Detroit, Maya had witnessed urban trauma, gang violence, gun wounds, emergency medical scenarios. At a young age, she had witnessed people being saved from life-threatening injuries. "I want to save people in extreme conditions," she had told the military medical recruiter. After basic training, Maya was selected for Medical Corps, then Advanced Medical Training, eventually Special Operations Medical School. Her academic and physical performance was exceptional. She qualified for the Delta Force Combat Surgeon Program. The Delta Force Combat Surgeon selection process was the military's most elite medical training. Advanced surgical techniques, battlefield medical operations, extreme pressure surgical procedures, hostile environment medicine. Maya ranked in the top 1% among female candidates. Her first deployment was Afghanistan. Forward surgical team operations, advanced surgery on combat wounded, evacuation medical procedures. During 2 years of deployment, she performed over 120 critical life-saving surgical operations. Her second deployment was Iraq. Urban warfare surgical support, surgical care for IED blast victims, mass casualty surgical coordination. Maya's specialization was precision surgery and advanced medical decision-making in extreme hostile conditions. Her third deployment was classified Middle East operations. Special Forces surgical support, medical coverage for high-value targets, covert mission surgical assistance. Maya's most dangerous and sophisticated surgical missions were executed during this period. Maya's Delta Force training wasn't just surgery. Advanced tactical medicine, hostile environment surgical procedures, combat zone operating room management, medical leadership under enemy fire, comprehensive expertise. "A Delta Force surgeon must be a complete warrior healer," said Training Commander Colonel Williams. "Battlefield surgeon, tactical medic, medical operations coordinator, life-saving surgery under enemy fire." Maya had completely mastered this holistic approach. Combat surgical procedures, sophisticated operations with primitive equipment, surgical precision in extreme danger conditions. Her medical expertise was far beyond attending surgeon level. The most critical training was hostile environment surgery, surgical procedures under enemy fire, complex operations with limited resources, medical focus in the presence of security threats. Maya learned to maintain simultaneous threat assessment and surgical excellence. She had specifically received tactical surgical operations training, operating room security protocols, medical equipment protection under attack, surgical continuity during combat situations. These specialized skills would be of unprecedented value in Maya's civilian hospital career. After 10 years of military surgical service, Maya made the decision to transition to civilian medicine. Combat stress factors, aspiration for normal life, commitment to peaceful medical practice. She made a career shift to civilian surgical practice. "Why are you leaving the Delta Force surgical program?" her Special Operations Medical Commander had asked. "Because I want to continue surgical service in a peaceful civilian setting. Same life-saving mission, different operational environment." During civilian surgical residency, Maya was extraordinarily overqualified. Advanced surgical knowledge, extreme stress management experience, tactical medical leadership capabilities. But attending physicians hadn't inquired about her detailed military surgical background. "I've always wanted to specialize in cardiovascular surgery," Maya had said, treating people's heart conditions, resolving life-threatening cardiac situations. Cardiovascular surgery was a perfect specialty match. Hospital surgical protocols felt familiar to Maya. Surgical emergency response, critical cardiac decisions, operating room team coordination under pressure. When City General Hospital hired her, Maya was an exceptional cardiovascular surgeon. Surgical expertise, crisis composure, advanced cardiac surgical skills. But nobody knew her extraordinary military combat surgical background. On Tuesday morning, April 14th, Maya was on her normal surgical schedule. With Dr. Chen and the surgical team, they had responded to 2 routine cardiac procedures: mitral valve repair, coronary artery bypass, standard cardiovascular surgical operations. The third procedure was a complex aortic aneurysm repair. 62-year-old patient Robert Martinez had a life-threatening aortic condition requiring delicate surgical intervention. Surgery had started at 9:30 a.m. with an expected duration of 4 hours. Complex cardiac operation requiring precision surgical technique and advanced medical expertise. "Challenging case, Maya," said Dr. Chen, reviewing patient charts. "Aortic aneurysm 6.2 centimeters, surgical intervention critical. Your surgical expertise is essential." "We'll apply standard protocol," said Maya. "Systematic approach, careful technique, patient safety priority." This confidence came from 10 years of Delta Force surgical experience. She had performed operations in much more challenging surgical conditions in combat zones. At 9:15 a.m., Maya was completing surgical preparation. In Operating Room 3, advanced cardiac surgical equipment was prepared, anesthesia systems checked, surgical instruments sterilized. Patient Robert Martinez was in stable condition under anesthesia. Cardiac monitors showed normal preoperative parameters. "Surgical team ready, doctor?" "Thompson," announced Jennifer. "Patient vitals stable, equipment functional, everything prepared." Maya switched to surgical focus mode. Delta Force training automatically engaged. Situational awareness, procedural excellence, environmental monitoring. "Jennifer, double-check security protocols. Marcus, verify anesthesia backup systems, standard precautions plus enhanced vigilance." Jennifer was surprised by Maya's comprehensive security awareness. "Maya, this is routine cardiac surgery. Hospital security systems are in normal operation." "Always prepared for unexpected circumstances," said Maya, but her surgical preparation was military-level precision. At 9:30 a.m., the surgical incision began. Maya accessed the patient's chest cavity and located the aortic aneurysm. Complex cardiac anatomy required a delicate surgical approach. "Aortic aneurysm 6.3 centimeters confirmed," Maya announced, initiating surgical repair, cardiac bypass preparation. Maya's surgical technique was of extraordinary precision, every incision calculated, every movement deliberate. This wasn't standard surgical competence. This was military-level surgical expertise. Within 30 minutes, Maya had achieved aortic access and established cardiac bypass. Patient vitals were stable, surgical procedure proceeding optimally. "Excellent surgical approach, Maya," said Dr. Chen, observing the procedure. "Your surgical technique is remarkably sophisticated." "Focused execution," Maya replied, continuing methodical surgical progress. At 10:15 a.m., the hospital security alarm suddenly activated. Red alert signals, emergency announcements, security lockdown protocols. Security alert, armed intruders in hospital. All personnel secure positions. Do not leave current locations. Immediate tension in the operating room. Anesthesia equipment continued, but staff became nervous. The patient was open-chested, surgical procedure half completed. Maya didn't pause. Her surgical focus was maintained, hands steady. Delta Force training, automatic response, threat awareness but mission continuity. "Jennifer, check door security. Marcus, continue anesthesia monitoring. Surgery proceeds normally." "Maya, shouldn't we stop the surgery?" Jennifer asked anxiously. "Patient is open-chested. Procedure interruption is life-threatening. We continue the surgical mission." At 10:22 a.m., gunshots echoed through hospital corridors. Armed intruders were advancing inside the building, security personnel engaging. Panic erupted in the operating room. Jennifer was scared, Marcus was shaking, surgical assistants were nervous, but Maya remained completely focused. "Dr. Thompson, we should evacuate," said Dr. Chen urgently. "Patient would die during evacuation on the surgical table," Maya replied calmly. "We secure the operating room and continue surgery." Maya immediately made a tactical assessment: operating room layout, access points, security vulnerabilities, defensive positions, military training, automatic situational evaluation. "Jennifer, barricade the operating room doors. Marcus, emergency mode for anesthesia equipment. Dr. Chen, assist with surgical procedure." Her commands carried military authority none had heard before. Maya implemented rapid security measures. Operating room doors secured, surgical equipment protected, patient safety maintained. "Jennifer, prepare surgical instruments emergency packs, ready for potential quick evacuation." "Maya, how do you know these security procedures?" Dr. Chen asked, amazed. "Emergency preparedness training," Maya replied, but her tactical knowledge was clearly advanced military level. Maya continued aortic aneurysm repair while simultaneously serving as security coordinator. Her surgical hands steady, precision maintained despite external threats. Patient vitals were stable, surgical procedure 60% completed. Maya estimated 90 minutes additional surgery required. "Surgery continues at normal pace," announced Maya. "Patient condition optimal, procedure proceeding successfully." At 10:35 a.m., gunshots sounded closer. Armed intruders were approaching the surgical wing, security engagement intensive. Tension in the operating room was at maximum. Staff terrified, but Maya absolutely calm. Her surgical focus was unbreakable. "Dr. Thompson, they're getting closer," Jennifer whispered fearfully. 30 minutes remaining in surgery," Maya stated. "Patient survival depends on surgical completion. We continue." Maya's hands moved with extraordinary precision. Aortic graft placement, cardiovascular reconstruction, advanced cardiac surgical techniques. Military surgical training was evident in every movement. "Your surgical composure is incredible," said Dr. Chen. "How do you maintain focus under extreme stress?" Maya paused briefly, looked at Dr. Chen. "Critical decision moment." "Because I'm a former Delta Force combat surgeon," said Maya quietly. "Major Maya Thompson, retired. 10 years Special Operations Surgical Service, 3 combat deployments." Complete shocked silence in the operating room. Gunshots continuing in the background, but staff momentarily stunned. "Delta Force surgeon?" said Dr. Chen with amazement. "You were a military combat surgical specialist." 10 years, battlefield surgery, hostile environment operations, surgical procedures under enemy fire. Maya continued aortic repair while explaining. Every surgical technique perfect, every cardiac intervention professional. "Why civilian cardiovascular surgery?" Maya's expression became serious. "In 2019, on a Syria mission, field hospital was targeted. 15 medical personnel, 40 patients. We lost many people. Silence except for distant gunshots. After that experience, I decided to apply surgical expertise in a peaceful civilian environment, save lives without warfare context. At 10:45 a.m., sudden impact on operating room doors, armed intruders attempting entry, door barricades holding. "Open this door!" shouted a voice outside. "Everyone out!" Terror in the operating room. Jennifer crying, Marcus hiding, Dr. Chen frozen. But Maya continued surgery. 15 minutes remaining for patient, Maya announced calmly. Aortic repair almost completed. Door barricade weakening, armed intruders persistent. Maya made a critical decision. Jennifer, assist with surgical completion. Dr. Chen, reinforce door security. Marcus, continue anesthesia monitoring. Maya's military command training activated, her surgical expertise combined with tactical leadership. "Maya, what if they break in?" Jennifer whispered. "Then we protect the patient and complete surgery," Maya replied with determination. The door barricade finally failed. 2 armed intruders entered the operating room, weapons drawn. "Everyone hands up." "Stop what you're doing." Maya looked up from open chest surgery. "Patient dies if surgery stops. Give me 8 minutes for surgical completion." "Stop now or we shoot." Maya's response shocked everyone. "Then shoot. But this patient dies if I stop." Her military training was evident. Mission priority, life-saving commitment, tactical assessment. Maya continued the surgical procedure, despite weapons pointed at her. "You're crazy," shouted the intruder. "No, I'm a surgeon," Maya replied, placing final aortic sutures. "And this patient lives." Suddenly, hospital security burst into the operating room. Armed intruders overwhelmed, situation controlled. Maya completed final surgical closure. Procedure complete, patient stable. In the following hour, hospital administration learned of Maya's military background. Emergency meeting convened. "Maya, why did you never mention Delta Force surgical experience?" asked Chief of Surgery Dr. Williams. "It wasn't relevant for the civilian surgical position. I serve as a cardiovascular surgeon." "Not relevant?" "Combat surgical training, extreme stress surgical experience, tactical medical leadership." Dr. Williams continued, "Maya, today's exceptional performance demonstrates extraordinary capabilities. We want to offer you a department leadership position." Maya considered. "I prefer direct surgical practice, patient care, life-saving operations. Your expertise could revolutionize our emergency surgical protocols." Dr. Maya Thompson's story isn't about surgical heroism. It's about the continuity of surgical service dedication, peaceful application of expertise. From Delta Force combat surgeon to cardiovascular surgery, from battlefield medicine to civilian cardiac care, from military surgical operations to community hospital service, always providing surgical excellence. So I ask you, have you met military surgical veterans quietly serving in your healthcare community? Hidden Delta Force surgical backgrounds silently contributing in civilian hospital surgery? Share your surgical experiences in the comments. Because at Hidden Legends, the greatest surgical professionals serve in the most critical healthcare moments. If this surgical story moved you, share it, subscribe, and help these important military surgical stories continue. We'll encounter you in the next surgical legend. Remember, on your next surgical procedure, emergency operation, hospital visit, you might encounter unaware military surgical backgrounds. Real surgical heroes transform their forms of service, but the healing surgical spirit never ends.